All right, I think it's time to get started. We've got a good audience with us here. I see people are still filing in, but I think that we have a really good program, but also a tight program. So I think it's time for us to begin. Thank you so much for joining us today. We have what I think is going to be a really interesting program with a panel of really spectacular panelists from around the world, experts in a number of relevant disciplines to discuss how to protect maternal health from toxic pollution. My name is Drew McCartor. I am Pure Earth's executive director. I've been with the organization for about 15 years. Pure Earth is an international nonprofit focused on chemical pollution and public health. We've been doing work to avoid exposures to toxic chemicals for 25 years. This is our 25th anniversary. We have a great moderator today. I want to introduce Debanjana Chowdhury as our moderator. Debanjana will introduce the rest of our panelists who come from the worlds of journalism and communications and project management and the medical profession, research, just a wonderful group of panelists. Debanjana is herself a professional with over 20 years of experience in climate action, gender rights, and has been a lifelong advocate for access to sexual and reproductive health rights. She's been the director of programs for MSI Reproductive Health Services in India, the country director for Power for All, which is focused on the climate crisis. And most importantly to us, she is our newest country director for India, directing all of Pure Earth's work there. Just a bit of housekeeping before we jump in and I pass it over to Debanjana. We have both a chat and a Q&A section in this Zoom room. So please put your questions in the Q&A box. And there will be a live Q&A session, hopefully if we have enough time at the end. But we can also answer questions in the Q&A box. We're pleased to offer Spanish interpretation during the event. Instructions to turn on the Spanish interpretation are in the chat room. So please go there to turn on Spanish interpretation. And I'd also like to take a moment to offer a special thanks to Laura Naiwa and her colleagues from the Peru Center for Disease Control for attending today and for consistently supporting our work to address pollution in Peru. So, Debanjana, over to you to introduce our panelists.
Thank you so much, Drew, for the kind introduction and for setting the context. I'm Debanjana Chowdhury. I'm based out of New Delhi in India. It's an absolute pleasure to be able to moderate this session and interact with all of you at the audience. Without much ado, heavy metal poisoning is a silent killer, and it's often missed out on our national healthcare and environmental budgets. And it has deep linkages to maternal health. And as we celebrate International Women's Day today, over the next hour, we will discuss the impact of heavy metal poisoning on maternal and reproductive health. We will hear from our panelists on real-life solutions, why it is important, why it is absolutely crucial to not just invest in this cause, but in women who are ultimately the champions and change makers in the communities. In alignment with UN Women's International Women's Day theme, Invest in Women, Accelerate Progress, we start our discussions. Thank you again, everybody, for joining in. So, all of you know, exposure to dangerous chemicals have multi-generational impact on women, children, and entire communities. This is a problem that has many solutions. Targeted interventions can reduce exposure, risks, and ultimately stop exposure pathways. And Pure Earth is a pioneer in the field, an organization that gathers evidence, builds evidence, and advocates with multi-stakeholders, raises awareness. And I'll stop there because we are going to hear right from our experts on how it is done. An honor to welcome again our panelists. Our first panelist is Dr. Lynn Panganiban. Dr. Lynn is a national consultant with Pure Earth Philippines and a toxicology consultant with the National Poison Management and Control Center of the Philippine General Hospital in Manila. Dr. Lynn, thank you for being here. So first to you. Thank you. So first, Dr. Lynn, it's wonderful to have you here. And when we talk about toxic metals and the impact on maternal and child health, why is heavy metal pollution a maternal health issue? And what are the greatest concerns, according to you, you being a clinician, if you could throw some light on it? And what are the exposure pathways of these heavy metals?
Okay, thank you for the questions, Debanjana. Before I move on to the questions, I would like to say good day to everyone. Thank you for joining us in this webinar. So perhaps to understand the effects of environmental pollution, especially on maternal and child health, let me first share three important points now for us to understand further how especially toxicants like heavy metals will really impact health of the mother, of the woman, and the child. So my first point, as far as the relationship of environmental exposures and eventually to illness, is that the response of a mother to toxicant exposure is very much determined or influenced by several susceptibility factors. So susceptibility factors such as just the age of the woman, some of the physiologic changes that the woman may undergo depending on the reproductive stage that she is in, and some of the biological makeup, and even nutritional status, disease states, metabolic states of the woman. So simple as like a woman having a poor nutritional status, this can lead to various metabolic and clinical outcomes, and such as anemia, electrolyte imbalances, some even vitamin and mineral deficiencies. And because of all these abnormalities, this can lead to altered organ systems. So if you have a toxicant exposure and you have a background status, no, of this mother that is not healthy at all, this will have some impact on maternal health, and the impact can be synergistic or it can be additive, because there could be some changes in how the woman will now handle the toxicant. And if we're talking about heavy metals, I will just maybe specifically give some examples when it comes to lead exposure. So example, if like say I mentioned about vitamin and mineral deficiencies. So if a woman who is deficient in calcium because of malnutrition, is anemic, and because of iron deficiency, this will have some effect in terms of absorption of lead, because lead competes with calcium and at the same time with iron. So now you have increased lead levels. So other than the underlying medical problem that the woman has at the moment because of some of this nutritional status, this will increase her susceptibility and vulnerability to the ill effects of lead or any other heavy metal or toxicant for that matter. Now, my second point is that though the toxic exposures can happen, as I think I mentioned earlier, that it can happen in any reproductive stage of a woman. But what is really important is that it is during pregnancy and even during a lactation period, or the time when now the mother is doing breastfeeding, that will have some impact in terms of the effect on the woman. Because again, when a woman is pregnant, there are physiologic changes that are happening and will make her susceptible again to the toxic effects, no, of metals for that matter. So again, example, going back to calcium, because the mother provides nutrition to the developing fetus that is in her womb, there is increase in the need for calcium, which is one important mineral that the fetus may need. And so during that stage, because there's increased calcium need by the fetus, there is such a thing during pregnancy as bone turnover. So there's a bone turnover because of the calcium need of the requirement of the fetus. And because lead, majority of lead, 90 to 95% of lead is stored in the bone, then we expect during bone resorption or bone turnover, there is again increase in lead in the circulation. So that's how important this is during the stage of pregnancy and lactation. My third point is that there is a very strong relationship now, or interrelationship, between maternal health and now the child health. Because when the mother is pregnant, it is almost like they say they're one. The child is very much, or the growing fetus is very much dependent on the mother for his or her growth and development. And the effect will not just be during the fetal period, but it can even go as far as when the child is born and eventually during adulthood. And what we call the developmental toxicity, because of maternal toxicity, the developmental toxicity can be both ways. It can be direct and it can be indirect. When we talk about direct, is that the toxicant itself passes through from the mother into the fetal circulation, and this is through the placenta, because the placenta is not an efficient system to protect the developing fetus for whatever insult the mother may be exposed during pregnancy. And so lead and mercury, arsenic, they pass through the placenta and can cause direct effect on the growing fetus. Now, the indirect effect is because I mentioned about maternal toxicity. So the mother is ill, and if lead causes, for instance, hypertension, and so there's gestational hypertension, it has been proven that this can lead to very poor pregnancy outcomes. So the pregnancy can result in a spontaneous abortion, or if the child is born, the child is of low birth weight, and there could be, of course, reduced fetal weight for that matter. And again, it would be the whole gamut of all the other toxic effects brought about by the metals. Now, why concern about heavy metals? So I already mentioned about the passage, the nature of these metals passing from the mother, being exposed, and now to the developing fetus. But what is, I think, concerning about the metals is that they by themselves will have intrinsic toxic characteristics. So lead, for instance, stays in the body for years, so like 20 years half-life. So it's that long. So it accumulates in the body, and as it accumulates, it can cause end organ effects. Number two, there's really no safe level for now when we talk about lead exposure, because even at very low concentrations of lead, then there has already been some findings of lead affecting the learning ability, even the IQ of a child, and even low levels of lead can also have effects on the adult or on the mother. Now, the third maybe characteristic of lead that we're concerned about is that it affects a lot of organ systems, and there are important organ systems such as the nervous system, hematologic system, so the blood, develops anemia, cardiovascular, hypertension. We also have affectation of the kidneys. So we name all organ systems, the lead is able to affect them. So these are characteristics that they are innate and something that we cannot remove because they're very intrinsic. There's something that they come with and that cannot be removed, as far as their characteristics. And I think you asked about exposure, Devanjana. We're exposed to these metals everywhere, and it can get into the body through inhalation, primarily through ingestion of contaminated products, minimally through the dermal or through the skin. So we will see that we breathe air, we eat every day, and so it's such a very close loop in terms of exposure and us absorbing this metal, affecting the woman's health, and eventually also having impact on the child, which is of long term. Maybe I'll end here and back to you, Devanjana.
Thank you so much, Dr. Lynn, and all the more reason why we should be talking more about it and why we should be raising awareness about it, because we need to understand the pathways. And very well put. Thank you for explaining the medical in a medical but yet in a layperson's language about how we can be exposed to lead. So if you want to know more about Pure Earth's work in Philippines, please follow our social media coordinates. They are given in the chat window. And now moving on from Philippines to Colombia, welcome Lizette Olaya, our country director for Pure Earth in Colombia. Lizette, it's a pleasure having you here. Mercury, a huge problem in Colombia, but you've achieved a lot. So before we talk about, how you achieved it and what were the successes in Colombia, we want to listen to you about, are there enough data, research, and estimates of how many women and children are exposed to mercury in Colombia? And if you could also share some details about the impact of mercury on health, especially maternal and child health.
Thank you very much, Devanjana, and a special greeting for all of the wonderful women that join us here as panelists as well as participants, and a special greeting for all my colleagues in Latin America. It's really a pleasure to be here, and we thank a lot for inviting Colombia to this conversation. Indeed, in Colombia, mercury pollution is a big issue for the country. According to the Ministry of Environment, the more affected matrices in the environment are soil and air. And according to the United Nations Environment Program in 2018, Colombia suffered from one of the most polluted countries regarding mercury. And 94% of this pollution is attributed to the poor practices in the small and artisanal mining sector. This is important because the Ministry of Health as well highlight the people that is vulnerable to this pollution, highlighting as well that the mining workers, those who don't use personal protection items, who burns amalgams, who storage mercury in their houses, as well as the people that is living in the surrounding areas of the mining sector, they are affected because of mercury, because they have contact with contaminated water, for example, and the more vulnerable groups in this contamination include the mining workers, the surrounding communities, and the children. So this is quite a challenging issue for the country, and the mercury pollution is also associated with with getting exposed to environmental sources, and this also, in some cases, occur because of the miners transport mercury to the communities without noticing that this pollution is going with them. The water is contaminated, so you don't only find mercury in the mines, but in other areas that have contact with the mercury. The atmospheric emissions, as I mentioned before, the air is one of the most polluted matrices, and the accumulation in crops. As you know better than me, the heavy metals have this challenging issue. The heavy metals bioaccumulate. So here in the country, that is a problem as well. And in Colombia, addressing both the occupational and the environmental exposure is critical to protect the public's health. You ask about these numbers, and here in Colombia, regarding the exposure of women and children to heavy metals, and in this case, especially to mercury, is not precise because it's presumed, as I mentioned before, that here the main source of exposure is the small-scale mining. And what happened with the small-scale mining here in Colombia? First, it is developed in so remote areas, so it is quite difficult to quantify and to get to those areas. And on the other side, the miners are a labor population that is under-registered. And this happens mainly because of formalization. Here in Colombia, we have high rates on formality in the mining sector. In this sense, but I would like to mention two studies regarding what Dr. Lynn was talking about, the maternal health regarding the heavy metal issues. In the case of Colombia, I have two examples only. One study from the 2015. This was a study made with women in the mining, in a mining community in Antioquia, a department in the north part of the country. And in this case, they do assessment of breast milk, and they find average levels of 2.5 milligrams per liter. And in 2018, another study was made, but in the south of the country, regarding women that consume fish that comes from the Cauca River. And they found in this case that as well, the levels or the permitted or the more the levels that are suggested by international organizations were exceed by a high number. So these two examples and a lot of research that has been done in the country is very important to arise the evidence of the problem in the country. Nevertheless, as you mentioned, these estimates are not an accurate picture of the overall situation in the country. These are representative and a research on some specific areas and scenarios, but don't cover the whole situation in the country. As this is a very important issue, because we well known that the people is exposed to mercury. We know for sure that the mining areas, the surrounding areas of around mining, and the water, the drinking water, the fish, the air pollution as well, and the accumulation in crops is a constant situation here in the country. So my final conclusion and reflection regarding this question would be that we need to have data. We need to have the information regarding exposure of children and women as the most vulnerable population in the country and around the world. And because this allows the governments, the people, the organization as us that we work towards the prevention of the health issues, of the health consequence of the exposure to heavy metals, to set goals, to prioritize actions, and to prevent defects in the public's health.
Thanks so much, Lizette. It's very in-depth. If I may ask a follow-up question on the need for research and evidence collection and data, is that, of course, it helps the governments to take action. It helps in moving the needle a bit. How does it impact if there is some research or data that you go to the community with? Does it impact the way community perceives the pollution? Is there any behavior change? Have you seen that?
That question is pretty interesting because we have quite a closeness to the mining, to small mining communities around the country. And at the beginning is quite a challenge because the people doesn't correlate their activities, their labor activities, and the pollution generated by them towards the health impact that they have. For example, we notice in some mining community and the north of the country, we were talking and discussing with a mining woman that has been working in this like 30 years ago. Is an ancestral and quite traditional activity for them because is that comes from generation to generation. Their grandmothers and mothers told them about the mining and they have this artisanal activity. When we present to them and we present to her that mercury is a high risk for health, she associates the risk because of the constant contact with water, but not with the mercury into the water. So it's quite easy. You repeat and you can repeat once and once and once and again. And this needs to be a task of every day to say the people again, maybe it's not just the water per se, it's not the fish, it's what is in the fish, it's what is in the water. So they are receptive, but maybe they are quite, they quite understand this correlation. But if you repeat and repeat the message, at the end, they understand that maybe this comes from something more than the water on the air per se.
Thank you so much, Lizette, for sharing that. Indeed, it's a challenge, and thus we need to be very persistent and patient with our, efforts in order to impact communities so that they understand the impact of mercury and lead poisoning. Shifting gears to South Asia, welcome Dr. Aditi Roy, who is a senior research scientist at the Center for Health Analytics Research and Trends at the Ashoka University and the Center for Chronic Disease Control and a DBT Wellcome Trust India Alliance Fellow in Clinical and Public Health. Welcome, Dr. Roy, and it's a pleasure having you here. Now, India is one such country where everything is extremely complex, and you are a research person. So if I could, put you in the research, if I could ask you to put you on your research cap. So what does the current data on prevalence of lead poisoning in India indicate? What are the estimates of it on MCH? And at the same time, if you could also share where are the research gaps in India and South Asia and how we could, fill these gaps.
Sure. Thank you, Devanjana. And really a great pleasure to be here. And thank you for inviting me to the panel. It's a very close to my heart. I would say that we have enough data to take actions, but we don't have, on the other hand, we have a lot of research gaps that need to be filled in India. And I think, overall in Southeast Asia. So you asked me about the prevalence, and in there also there has been a systematic review and meta-analysis of the existing primary studies. And people have been doing that. And I saw just yesterday a preprint has been put out, and I'm happy to share that. That has been, and that's significant because that prevalence analysis has been done by the National Institute of Occupational Health, which is a government-funded institute. And it's important because there is a trust building issues with who is doing the study. And it's always good to include the research agencies that are funded publicly. Having said that, I think what they found is that India has made progress in terms of when we banned lead from petrol globally. It's a global public health success. And so as in India, which happened in 1996, is a phase out ban. And then in 2000, we banned completely the petrol from lead. Which has direct impact in blood lead level, and it has gone down, especially in the non-occupationally exposed population, which is the general population. However, what they found is that in the high-risk group, which is the occupational groups, that time trends is not that very clear. So there may be pockets of decline, but then again, increase in levels. And so, but having said that, even in the non-occupational exposed general population, we see the average exposure level is almost 11 microgram per deciliter. And if we go by the CDC's reference level for action, which is right now is 3.5 microgram deciliter, because in most of the high-income countries, the levels have gone down. And that level is not a safe level, it's just for taking action. And so majority of the Indian population is above that level. So we are at the level of 10 microgram per deciliter. I'm talking about children here. And there is a nuance of how we are, assessing the prevalence, because in children, maybe blood lead level is appropriate because it is sort of like their lifespan is not that significant to, that they have accumulated in the body. However, if we look at the women and elderly, I think the levels will be much higher, and we need to look at the cumulative exposure. And there is wonderful studies coming from high-income countries actually showing that there are intergenerational effect, and it's not the direct effect right now. It's the the granddaughters of granddaughters that is getting affected with the lead exposure that we are having now. So that is overall the prevalence are. And you talked about the research gaps. I think I feel like there are three major areas of research that really needs attention. One is periodic biomonitoring of lead and other heavy metals and chemicals. And that should include not only children, because right now all the data are mostly in children. That should include women, and men, because I think Lizette just mentioned that men also bring occupational exposure to home, and also indirectly their health and their exposure is related to family health and family income and economic situation. So it has to be a family based periodic biomonitoring. And also, if some interventions or policy actions have been taken, for example, lead has been banned, so-called in paint, then that also need to be monitored over the years to understand whether that had any effect at the population level. Now, why we talk about biomonitoring, and I know that there will be talks around that. In India, we really lack capacity building in terms of laboratory and also innovation and funding to find low-cost screening method, because we have one company providing screening tests for all the, across the world. That doesn't work for us. So we need more indigenous, India-developed, low-cost, innovative instruments for biomonitoring as well as environmental monitoring. Then second point, source identification. I know that Pure Earth has been doing a great work in that space, but we need context-specific source identification to be continued. And the third one is coming from a public health. It would be wrong for me to say that not looking at health impact, and we don't have better estimates of maternal exposure or impact. Or also not only maternal, I think we should look at the life course approach, and especially the missed out population, which is the adolescent girls, because they will become pregnant and they will carry the burden of these heavy metals to the next generation and next generation. So we really need to think about health impact in terms of the life course approach. So that will be my three major research areas.
Thank you so much, Aditi. I think, you made very, very pertinent points and extremely helpful in sharing those research gaps. And you make a very valid point about, understanding the data from adolescent girls and men engagement and men inclusion in the entire data collection and research. So from now, evidence to storytelling, journalists play a huge role, rather a very significant role in drawing eyeballs to the issue. Communications is one such aspect that raises awareness, grows conscience, and educates communities and stakeholders likewise. And our next panelist is one such comms whiz, Mitali Das. Mitali Das is a communications lead for Pure Earth Bangladesh. Her film about a child affected by lead poisoning, 1 in 36 million, won the Grand Prix Award at the World Health Organization's 2023 Health for All Film Festival. And you can learn more about it. You can, go to the Pure Earth's website as well as the social media handles and learn more about Mitali Das's film. But thank you, Mitali, for joining today. And we want to know, what's the role of communication and raising awareness on lead poisoning in the issue? And what actually is the story behind the 1 in 36 million? What drew you to document such an impactful, film?
Thank you, Devanjana. It's an honor to be here, and thank you everyone for joining today's webinar. So if I may start with a quote of a mother that I met during our lead remediation project in Mirzapur, Tangail district in Bangladesh. So she told me that I wish I knew that lead can impact my child. Then I would not be here. I would have gone to my village. So information about lead is that level of, it's that life-saving for mother and child. So I think as we already know that lead has a complex, impact on environment, health, and economy. So so in this fast-paced tech world, it's very important that we simplify the research-based information and simplify it and give and try to reach out to wider audience, and also bridge the gap between the research and policy, which is very essential for successful advocacy. And this is what we do in Bangladesh. Though Bangladesh is the fourth most lead impacted country, and over 36 million children are poisoned by lead, but the awareness is very limited due to actually the nature of problem. We call it a silent killer because the impact of lead is not visible immediately, and also their lack of funding and also lack of understanding about the research impact, health impacts. So I think these are some of the challenges that really needs to be addressed through effective communication. And 1 in 36 million film was one of the efforts to kind of address that issue, that how we can actually show, give a visibility of the problem through a simple story of a mother and child. And this story is not about only a child poisoned by lead from Bangladesh. It also represents the 800 million children who are poisoned by lead globally. And this film has been showcased in different workshops and and trainings and different platforms, and that helped immensely to raise awareness about childhood lead poisoning especially.
Thank you so much, Mithali. Simple yet extremely impactful story that you shared with all of us over here. The woman saying that, she wouldn't have been there had she known about the consequences of lead. Thank you so much, Mithali. We learn more about communication pathways from you. But moving on, our next panelist is an absolute inspiration. She's a journalist who has worked on harm reduction and has worked on significant impact on lead. Nadima Umar Uthman, she is a journalist and news presenter with GH1 TV, a major news channel in Ghana. Welcome, Nadima. She has recently received the bronze medal at the 27th Annual United Nations Correspondents Association UNCA Awards for her coverage on the impacts of lead poisoning on pregnant women and children in Ghana. First of all, many, many congratulations for this award. So Nadima, tell us what motivated you, what compelled you to do a piece on the issue. Share a brief about your investigative piece. And also don't forget to check our social media to learn more about Nadima's piece.
Hello, everyone. Greetings from Ghana. And I think Dr. Lynn's presentation just took me back to why I decided to do the piece that I did on lead poisoning. And I think exactly a year ago, Pure Earth came to our newsroom. I was fortunate enough to be in the newsroom at the time. And then the director for Ghana actually came to the newsroom here in Accra and was discussing the impact of lead on the general population, particularly on pregnant women and children. And I reported on diverse issues when it comes to health in Ghana for close to 8 years. And I've heard of lead poisoning casually, but I'd never paid critical attention to the impact until Pure Earth came to the newsroom. And since then, something just dawned on me that, no, this is something that I need to throw light on. And my way as a journalist is to tell the story and inform and educate the public. And so the story that I worked on was from a community in Ashaiman in Accra, a densely populated area with migrants from other parts of the country who have largely come to look for sort of livelihood in the capital. And so when I went there, I saw a number of women and children. And before I even engaged them, I had seen, in Accra, unfortunately, one of the issues that we have is the indiscriminate or improper disposal of lead from car batteries, and is rampant in a lot of communities, a lot of the densely populated areas. And then I saw a child. He was playing near where they had disposed of the lead. It was like a gutter, and his hands were in there. And for me, that just struck a chord. And I decided to do that piece and spoke to the pregnant women, the people in that area. And when I did the story, I did not even imagine that the impact would be as great as it was, because then again, a lot of people don't know about lead poisoning in Ghana, because largely it's not talked about enough. There's low awareness, but we are also highly impacted because of activities of scrap dealers and the lack of regulation. When it comes, the regulations might be there on paper, but unfortunately is not enforced. And so that was why I decided to work on that piece.
That's absolutely awesome that you worked on that piece, Nadima, and how it struck a chord with you. If you could also share a little bit about, the role media personnel can play in highlighting this issue. We don't often see a lot of people talking about lead poisoning or even mercury poisoning. So we don't see a lot of people taking interest in it. If you could share, have you heard from your colleagues? What's the reason? Or are their colleagues more interested now to do something on this?
I think when I did that story, it started from the newsroom. A lot of people started asking questions like, what are duty bearers or the agencies who have been tasked to ensure that the regulations are enforced? What are they doing? And so for me, I think as journalists, what we can do is to tell the stories, go out there, tell the stories to inform and educate people. Then again, when the duty bearers watch and they are pushed enough, then they can start enforcing. Because Ghana all the time, and I say that the media says the agenda, but unfortunately, we're always talking about politics. Politics is great, but health is wealth, like we always say. But unfortunately, when it comes to critical topics like lead poisoning, it's not talked about enough. And even a year on, I would say that the conversation still needs to be improved. A lot of journalists need to get involved. But how did I get involved? Pure Earth came to the newsroom and we're talking about the statistics and the impact, and I got interested. And so I think that a lot of collaboration needs to be done by those who know. Journalists don't know it all. And so for the amazing work that Pure Earth is doing, if they can collaborate with other newsrooms, just like GH1 benefited from, other newsrooms as well, journalists can also benefit from the workshop that was done. And so we can get the interest and go out there and tell the stories that needs to be told.
Thanks so much, Nadima, for the share. I would like to remind our audience, kindly share your questions in the chat. Please mention if you have any panelists in mind for your questions. And please don't miss to like, follow, and share our messages on social media. And you have all the coordinates in our chat for more information. Dr. Lynn, if I can come back to you. And right now we want to shift gears to solutions. We heard the problems, we heard the need for storytelling and the wonderful stories. Now we want to know what are the solutions. Can you tell us about the recent project in Philippines where the National Blood Level Surveillance Program was developed? How did it come to be? What were the challenges? How did you overcome? And what are the long-term benefits, the long-term maternal and child health outcomes for having the surveillance program?
Okay, thanks, Debanjana. It's been a long journey actually in our country in making people really aware as far as the ill effects of heavy metal poisoning, especially lead. We did a lot of studies as far as communities exposed to lead in communities that whose environment would be living near industrial settings. But what would come to mind would be what will be the impact of lead in a general population, especially for women and children. And we've been doing projects left and right, both Pure Earth and the National Poison Management and Control Center. But we wanted to do something on a national scale. During the pandemic, a lot of people start here in the country, especially Pure Earth Philippines, began starting to where should we put our focus on, though we are into case investigation, but what about the general population? So that was the time when our Pure Earth National Director, Lara Ibanez, approached our Food and Nutrition Research Institute, who does our expanded National Nutrition Survey. So they cover larger areas. So these are like 25 survey sites all over the Philippines, and open the idea to them that if we can include blood lead levels in the nutrition survey. And we were grateful that they said yes to that. And so sometime even during pandemic, we had participants, both mothers, pregnant mothers and children who are in that survey participated. We wanted to get our own national levels, not just estimates. And so maybe I'll just give just a brief some results of that. So I mentioned about 3,000 children, and our levels of blood lead, average blood lead levels among these children are a lot lower than the levels that we would see before among children who were living in toxic sites. So as for that 6 to 9 years of age, which was also the age group included in the survey, our blood lead level was about 1.96 micrograms per deciliter. For pregnant women, it was lower. It's about 1.6 micrograms per deciliter. However, if we look at the whole population of the 6 to 9 years of age, that is still about 9% of our children would still have levels greater or equal to 3.5 micrograms per deciliter, which is the action level set by CDC, Centers for Disease Prevention and Centers for Disease Control and Prevention. And if you translate that, it's almost like still a million children of that 6 to 9 years of age. And from there, we also have to look at site exposures. I think Aditi was mentioning about really looking into where would all this be coming from, not just from the toxic sites. And so the team also went ahead to do a rapid market survey of the common stuff that households would be exposed to. We also did home-based assessments, especially among the children who we found to have levels above the 3.5 micrograms per deciliter for us to see if there's really some exposures in the homes, which of course we did see. But we didn't stop because we really wanted to push through and do something about it. And so though it was quite a difficult task because we're dealing with like 3,300 families, we had to reach out to them, we had to engage them, we had to provide them with the results of their tests, what these tests would mean, what are the things that they can do so they could avoid further exposure for those children who will be needing further assessment, health assessment as far as their medical condition is concerned. Our center, the Poison Center, went to the communities to examine the children, the pregnant mothers, and now they're already mothers, the pregnant women, and now they're mothers, and explain to them now the significance of why we're concerned about lead. So it made them start to ask, what next? So because engaging ourselves with communities for them to really ask. So, and why is it a concern? How are we going to make sure that we will not be further be exposed to this kind of a metal? So together with the community, we also had to engage with the local government units, and that's through their health authorities, local health authorities. They were very much interested on what is the situation underground. Though we gave them the national picture, but what was interesting is that they wanted to know what is happening underground on their own community. And it started 2 municipalities or 2 cities here in Metro Manila to say that we need to start off a monitoring and surveillance system. And so at the moment, we are working, Pure Earth Philippines is working with these 2 cities. We're establishing a technical working group. We're looking at guidelines, training programs, and starting off a lead monitoring, surveillance, and case investigation involving first the vulnerable populations, like children with now already diagnosed with some developmental challenges and disabilities. And we're so excited because they themselves are seeing now the significance, and they would say that the levels are low, there's still enough room for us to do something about it. Because even in the environment, the levels are high, but it has not reached yet, not the blood levels of children. So this is something that we can do. So we hope that engaging communities and even the lawmakers and the significant stakeholders in community, we hope that we can move and really start a true monitoring system in the country.
Thank you so much, Lynn, for sharing that. I apologize. We are running a little bit tight on time. So thank you for sharing the incredible work. And all those of you who are interested to learn more about it, please look at our chat. You're going to find more about Philippines' work over there. Moving on from one incredible achievement to the other in Colombia, Lizeth, you involved the Ministry of Health. How did you get them to prioritize the issue of mercury poisoning? And if you could very briefly share some of your successful projects.
Thank you very much, Devanjana. Yes, the Ministry of Health, as I mentioned before, Colombia is one of the countries that suffers the worst mercury pollution. So this is a big issue for the country. In our case, we are trying to support as much as possible from our corner. And our projects focus on the identification, assessment, and remediation of toxic sites through innovative technologies and methodologies for trying to help and to support the country in tackle this issue of public health and environmental concern. So the efforts include collaborative efforts with the public sector, private sector, academia, and the donors to promote the responsible management of the mercury and cleaner and safer mining practices. Among a huge portfolio of projects here in Colombia, And I want to congratulate the great team that has been doing this work during the last years. We implement the toxic site investigation program, the mercury contamination index that allows to quantify and rank the health risk of contaminated sites. We test the development of an economic model for the recovery of mercury from the mine tailings in Colombia. This was done both with physical and chemical processes, including copper plates technology, and we test a circular economy model with information of 80 tailings in Colombia in 11 departments. Last but not least, the most recent program that the project that we implement, it was a modular technology that used copper plate technologies to recover mercury from contaminated tailings. And from more than 300 tons of recovered mercury, we identify the result as 84% as the maximum level of recovery of mercury. Through this process and doing in the same matter of communities, we train around 280 miners through this process, and this particular technology was awarded with the Conservation X-Lab Global Mining Award. This was a very, very important project because it set some important milestones for the country, as the recommendation of improvement for protocols in the safe storage of mercury and the installation of the first facility in Latin America for temporary storage of mercury. This was a great milestone for the country and sets the beginning of this kind of process in the country. In this same process, we establish or support the establishment of the National Mercury Roundtable. Someone in the chat was asking about the policies and how the countries tackle contamination. And we understand, and here we support this interlocution and coordination within the entities to work towards the same goal. And regarding your question on how the government prioritizes this issue, the pollution issue in general, and particularly in mercury, the national government promote safer mining practices, support the affected communities, and these efforts are framed in the regulation. Here in the country, just for telling, as we are short on time, the most important regulation here in Colombia is the, from our point of view, is the Law 1658 of 2013 that look exactly and prioritize health and the protection of the environment and the resources through the regulation of the use, import, production, marketing, handling, and the release of mercury to the environment. And afterwards, in the same year, Colombia signed the Minamata Convention. This is very important because this moved the commitment of the country with these international conventions, and it was ratified in 2019. Follow that and framing all of the efforts of the country, there was established the National Mercury Action Plan in 2018, and it is currently updated. And through this plan, the country pursue to implement the formalization of the mining sectors, establishing market incentives for cleaner extraction processes, the remediation, the environmental protection. And this is quite important because through these mechanisms, the different entities in the country are aligned under the same goals. The action plan in mercury gives these guidelines, and all of the sectors, the mining sector, the environmental sector, the commercial sector, align through these guidelines, and these support the country to be able to tackle the contamination process. But last but not least, we would like to highlight that in our country, one of the biggest challenges here is that, as well as mercury and other pollutants, as my colleagues in the panel mentioned, as lead, have and raised this important in order to be able to protect the children and women for the consequences of these metals in the health.
Thanks so much, Lizette. It's a wealth of information over here, and our extremely talented panelists here sharing a lot of information on how they are engaging with the community. Since we are talking about empowering communities, multi-stakeholder engagement, I would like to go back to Mithali and understand, like, how did you engage with communities? We also had a question in the chat in our Q&A wherein they wanted to understand, like, how do you empower communities? How do you engage as well as empower communities? And what are the tools that you have used to build that trust, and how has it been? Mithali?
Thank you, Devanjana. I think we always organize community gathering events before implementing any lead remediation activities. So most of our communication activities we have implemented during any risk mitigation projects areas, and I think the kind of information that we have given to disseminated among the community members, those are through stories, so that people can easily remember those information and can implement those in their practical lives. Maybe I can share tools that we usually use during our awareness activities that we do in the community. So this is a flip chart that we usually use in different courtyard sessions or in different home visits where we so this is a flip chart where we actually told a story of a mother and a child and how they were having a very happy life and they were impacted through lead when they had a used lead acid battery recycling factory near their village, and through that we have also shared what are the other potential sources could be of lead, and through very storytelling process we have showed it in a picture, like how they will identify that how they are getting exposed to lead from their daily commodities. And these are not something we give as a knowledge, but also we run these sessions through discussions so that people can have more engaging discussions during these programs. And also in after one of our community gathering event, a lady, actually she used to be a informal battery factory owner. We have recently remediated that area which is in Khulna. So I would like to share a photo of her. So during that awareness event, we have shared this leaflet, and when we visited that remediated area to do some shooting, she actually came running to me and showed me that I have received this leaflet from that event, and I still kept it. And I also read it to my son, and we now know that the impact of lead, and we will not run this kind of factories anymore. So this shows that how raising awareness can also help to bring change in behavior, and we are trying to do it through storytelling and through simple language of the messaging, and also making our tools more pictorial, and also we are engaging health workers, we are engaging community leaders, religious leaders, and also local government agencies, so that they can work together and build the trust and give more and that gives more authenticity of our work that we do in the community.
Thanks so much, Mithali. And it's a great leaflet that you have done. And because I read the language, it's wonderful that, you have made it, you have taken it into a such local context and spoken about breathing over there, Shash Koshlo, and all of that. So thank you, Mithali, for sharing it. If I can swing back to Aditi, but before that, I have a request for all of you at the audience. We have such experts over here that we are not able to wrap up in the next 1 minute. So if you are able to kindly hang on for 10 more minutes, and we would like to hear a little bit more from Aditi as well as Nadima. So Aditi, over to you. What role does research play in maternal and child health?
Thank you. And I think I will be very, very brief. I think I guess the research can really inform where our funds should go, because we have competing problems in a country like India and in all across the countries that we represent. The first question you get from a Ministry of Health, why should we care? So I think we also need to think out of the box to say, why should we care? Which should not be a question, but in a country where we do not have good regulatory system, we need to think out of the box. And maybe one of the ways, I don't have the solution, but I think one of the ways could be to engage the policymakers and of course the community and all the other stakeholders from the beginning of the research. So from the ideation of a research project and research design, and we need funding support to do that, so that that inbuilt participatory method is the first step and not the last step when we are to do the dissemination, because we might miss some of the stuff that are important for the Ministry of Health, Ministry of those who are making the policy. So engaging, and this also gives them more impetus to an ownership to the research and data that they will be using, and not really, for academic purposes. So I think more research engagement would be very important from the beginning.
Thank you so much, Aditi. It's really important what you have said about more funding for research and creating that evidence, because that's the first step towards making any, bureaucrat listen across the table. Thank you so much.
Can I just make one more point? Because it's a global event. I do think that the global push is also important. And I think, for example, Mercury and Minamata Convention and being mentioned, but I think we need lead, arsenic for other heavy metals, also something that global push, which actually things like air pollution and climate change is receiving, but unfortunately, heavy metals are not receiving that attention, being it from the funding or being it that global push, where the countries are answerable to that. When those convention and conferences happen, they need to show the progress where they were and where they are. So that global push is also important.
Perfect. Very points there. Thanks, Aditi. Nadima, we heard about, what interested you, what motivated you, and how Pure Earth went, and you were intrigued. We want to know from you, throw a challenge to your fellow journalists to take up the issue. And if you were to throw a challenge, how would you like them to cover this issue? And did you face any kind of challenge, any backlash while you were reporting on lead poisoning in Ghana? What was
Absolutely. The challenge I faced there were quite a number of challenges in doing this report, but largely with the people that I wanted to engage for the story. Initially, they were very apprehensive. They did not want to speak to me because they thought that when I aired the story, or when I finished the story and it's aired, government officials will come and eject them from where they're living, because bear in mind that these are people who are migrants from other parts of the country and looking for source of livelihood here in the capital. But they were very apprehensive. They did not want to speak to me because they don't have anywhere to live, and so they would, despite the harm, knowing that where they're living is not healthy enough for them, or they're exposed to lead, they'll still prefer to live there because they don't have any alternatives. And so I think for me, the awareness is still low. We still need to do more, but one person cannot do it. GH1 TV cannot do it. More journalists need to get on board. And how do you get on board? We need to learn more about the impacts of lead pollution on all of us, because we are all likely to be exposed to lead. Like Dr. Lynn said, that sometimes it's even through the air that we breathe. And in Accra, unfortunately, it's highly polluted, and government and stakeholders need to do more. We have the regulations, but we need to enforce them. The fact that somebody does not have an alternative means of livelihood is not an excuse for me. And so for me as journalists, I feel like we need to do more to bring awareness to this issue.
That's wonderful. Thank you so much, Nadima, for sharing that. So all the journalists, all the media personnel friends listening to this webinar, please don't forget to talk about this issue. Don't forget to report about this issue. And also this webinar is being recorded, and the link will be available to all of you. Please share the word, spread the news. We are unfortunately not able to do Q&A, but our extremely generous panelists, they are going to respond on the chat. But I'm not letting you go easily. It's an International Women's Day panel, and I want to close with a question, a common question for all of you. And maybe Nadima, you can start. Like, what's the role that women as change makers play in finding solutions?
Well, women are very important. I'm not being biased because I'm a woman, but women are the caregivers. We nurture the home. We bring forth life. We nurture children from all over the world. And I feel like the role that we play in this advocacy cannot be overlooked. But then we also need to be empowered. There needs to be more. We need to arm ourselves with information. And Dr. Lynn's presentation was just so apt, and she told us how this lead pollution can affect us, and not just this generation, but the generations to come. And so I feel like as we're empowering women in all spheres of life, we need to also arm them or arm ourselves with information, because thankfully now there's enough information to read and learn. So I think that we need to be proactive.
Thanks so much. Mithali, how about our Bengali women? How do we make sure that they are empowered enough to take charge of the solutions in our communities that we work in?
I think we take approach of awareness before any kind of regulatory actions. So we raise awareness among the women about the issue, about the sources, and also how it impacts on the maternal health, and we are actually giving some alternative solutions to them, and I think before going to the community level, the problem is it's more like needs to have impactful actions from the government authority, because it's a huge national issue, and yes, we are raising awareness to raise their voices of these women and demanding for the change, and that is really helping to echo the whole things, and the scenarios are changing, and how government are coming forward with different initiatives, especially surveilling the blood level of children. And also Bangladesh has a very good example of phasing out lead chromate from turmeric. And also government is now working very closely with Pure Earth, especially Department of Environment and DGHS from Ministry of Health. So these all shows a very positive impact of from the government level. And surely this was possible because a lot of youth groups, women, community people together, they are raising voice, and media. So it's a unified act, like like efforts.
Thanks so much, Mithali. We'll go back to Colombia. Lizette, role of women in making such changes.
Devanjana, we are leaders. We are natural leaders, and
Okay.
as the Dr. Lynn mentioned, we will be, or more, some women will be mothers. So that is very, very important. We because men are our partners. They work together with us. We can join forces, but at the end, because of the biology, we are going to be the ones that create life in the future. So in those stages, in those early stages, we can see closely the effects of the heavy metals in health. So as leaders and mothers, I think that we can make a great change.
Thank you so much. Thank you so much, everybody. We are really, really tight on time. Thank you, our wonderful panel. Thank you, Dr. Lynn, Dr. Aditi, Lizette, Mithali, and Nadima. And a great information that all of you shared, a lot of expertise that you all brought in, and a lot of information that you shared with all our panelists. Back to you, Drew, for closing the session. Thank you again, everybody.
Thank you. You know what I find astonishing is that the importance of this issue and the power of these panelists are demonstrated by the fact that almost everyone who attended this webinar has stayed with us past the hour to hear the closing remarks and the final questions here. I want to, as we wind down, I want to thank our moderator, Debanjana, and our extraordinary panelists, not only for their insights, but for showing us that progress is possible and it's happening. Of course, there's much, much more that we need to do, but we're making progress right now, and it's tangible, and it's measurable, and it's real. In recent years, we've seen the world start to wake up to this issue in a way that is new in my 15 years of working on this. Most recently, we saw the administrator of USAID, Samantha Power, go to Davos and make a full-throated endorsement of the lead issue, asking world leaders and policymakers to prioritize this issue and for funders to fund this issue. We've seen commitments from governments around the world. The Philippines, you heard about the surveillance that the Philippines government has embraced. We've seen political commitments in Ghana, in Georgia, in Bangladesh, in Peru, in many other countries around the world. So we're seeing progress, but we're not there yet. And what we really ask all of you is to join us in asking your local communities, your national communities, your governments for increased media attention, to make political commitments, and for donor groups to start to prioritize this in their own funding portfolios. These types of interventions that we've heard about, they're terribly underfunded and they need support. So finally, I just want to let everyone know that a recording of this webinar will be published on Pure Earth's YouTube page, so you can find it and review it and share it there. And you can follow Pure Earth on social media. Our handle is always @PureEarthNow. And you can learn all about the work that Pure Earth does by visiting our website at pureearth.org. And finally, if you have any final questions or you want to reach out to us to explore collaborations, partnerships, or just to learn more about our work, please reach out at info@pureearth.org. And finally, thank you so much for joining us. Take care and have a great day.